Sharon here with Bedside Therapy Lamps. So today what I want to do is I want to talk about the 4 myths about depression in the elderly. So let's go on ahead and get started. Now the first myth is depression is a normal part of aging. Now although depression is not a normal circumstance for the elderly, it is quite common. In fact, it affects roughly 20% of the elderly population, which is a rate twice as high as the general population, which is about 10%. And there are many elderly not affected by depression. Those who tend to be unaffected have some of the following characteristics. They have social supports in place. They are also involved in activities and hobbies, especially when retirement occurs. They have no previous history and no family history of depression. They continue to feel as if they serve a purpose in life. They also have less serious medical conditions. So let's move on and talk about the second myth, which is the elderly cannot benefit from treatment of depression. Now, when identified, treatment can be very effective in the elderly, and the key is identification. And just like in younger people, treatment often involves antidepressants. Now, these medications can take a bit longer to take effect in the elderly, but they do work. Also, cognitive behavioral approaches and counseling can help. Also, increasing social supports and getting daily exercise are very beneficial in aspects of getting better. So let's move on to the third myth, which is there is no risk of suicide in the depressed elderly. Now, unfortunately, suicide is one of the most deadly complications of depression in all age groups. However, it is particularly of concern in the elderly. Statistics illustrate that in 2004, in the United States alone, 11 out of 100,000 people, depressed people in the general population, committed suicide. However, that number rose to 14.3 out of 100,000 for people over the age of 65. And this number grew to 49.8 out of 100,000 for white men over the age of 85 years old. Elderly men are most at risk of suicide. Men in particular always tend to use more lethal methods, resulting in a completed suicide. So we're going to move on to the fourth and last myth, which is depression means dementia is just around the corner. Now, studies have shown that there is a link between depression and dementia, with more people with depression getting on to develop dementia. However, it does not mean that everyone has this fate. In other words, just because someone has depression does not mean that he or she will necessarily go on to develop dementia. However, to complicate matters even more, depression and dementia can coexist in the elderly. And at this point in time, there is no clear evidence that suggests that depression causes dementia. However, it has been noted that increased bouts of depression increase the likelihood of developing dementia. So in summary, what I've just covered are the 4 myths about depression in the elderly. And I've just outlined it above. And depression is very prominent in the elderly. And no matter what the age, it is always important for depression to be identified so that proper treatment can take place and then real living can resume. Now that's all I had for you today. I do have more trainings coming down the pipeline. If you have any topics you would like us to cover, please contact us. I'm going to share our contact information towards the end of this video tutorial. Just let us know what kinds of topics you would like us to talk about or cover in our trainings, and we will try to get that together for you. So if you have any questions or you want more information, please contact us at 866-284-6296. You can also email us at orders@bedsidetherapylamps.com. Until next time, thank you.